This is Andrew Kramer, Urology Associates, Cape Cod, bringing you a penile implant again from this week. This gentleman comes from out of town. He's got both Peyronie's, as you see. He's got a dorsal upward curvature. It's caused penile shortening and ED and a bend and among other things. His pain is resolved, but that curve and penile shortening remain, and he's got ED as well. Could be related, but could just be independent factors that come with age. Age being the independent risk factor. So we're going to dilate the corpora, and I think this is the stage, I would say, of the thousands of implants I feel like I've gotten the most improved through the years at, of getting right to the tunica, the pearly white level there, layer, and once you get that, you've got control of the corpora, and you can operate most effectively. Operate means get the best cylinder in, the best length you can, and minimize bleeding, and make your procedure the smoothest. If it takes you a very long time, or you're very sort of rough with getting down to the corpora, it prolongs your surgery, more swelling, difficult outcome, and you can't maximize the length. So that's what we need to do, and we're going to use the tricks. We're going to use the scissors, we're going to use the furlough, as you see, to get all the way up. The tips, we're trying to get as high up as we possibly can. Knife to open the corpora left and right, blue dilator, and furlough again, and we'll get the reservoir on the left. This is my typical position for that, being right-handed, and then we just got to put in the cylinders. You got the corporal space there. We got the cylinders matched up to his size, ready to put them in, and if you can do it quickly enough, it's just a plug-and-play move here, if you sort of have these moves down, because you got the penis measured and dilated, you got the place, you got to put the cylinders, you got the cylinders right there. Now you just need to have I would say, an efficient move to put the cylinder in. Sometimes it's not as easy as it looks, because you've got to get it all the way up, you've got to slide the bottom down, and you want to stay in the axis, meaning up is up, left is left, right is right, because the cylinder is getting crossed or twisted is a big source of problems that probably are corrected in surgery most of the time, but lead to a more complicated, difficult surgery. So cylinders are in, we're going to test it. Now I know he's going to have some curvature, but how much, and can we fix it on the field? Let's see what happens. So you can look, the penis doesn't look anything like what it's going to look like in a minute when I pump it up, which is great, because the cylinders, the implant really makes the penis look better. See, when you pump it up, how much more girth he got, the length really improved, and so does that curvature. So that's what we got to do, is fix that curve. How are we going to do it? We're going to use the two-handed approach. You got to spread the force along a long axis. You can't sort of crack it. You got to take those fingers, you see the left hand bending along the length of the penis, because you don't want one point to take all the force on it. You want it to be spread, because we're trying to bend something, not snap something. So hands are on the penis as we bend it and crack it. And when we do it, penis gets much, much straighter. As you can see, pump, low, deep, and dependent. We're ready to close. There, closing stitches are in. He will be healed in just a couple weeks. Andrew Kramer, Urology Associates, Cape Cod. Thank you.